Well, health officials tell us that that same strain of bacterial meningitis that claimed Thorpe also took the life of a UW student earlier this month.
But so far, experts say they see no connection here. News 3's Linda Eggert has more on that and this particular strain of meningitis. Linda.
That's right, Eric and Susan. Public health experts today said the same bacteria, or meningococcal meningitis, is responsible for claiming a second young life in the Madison area in less than 2 weeks. February 2nd, 22-year-old UW senior Neha Suri of Singapore died in the hospital of that kind of bacterial meningitis after being ill for a short while. Now it's clear the same bacteria has taken an even younger life from the Mount Horeb community, and even more suddenly. The Dane County coroner says 16-year-old sophomore Halium Thorpe was pronounced dead at her home Saturday, and so far public health officials aren't aware that she even showed any symptoms of the disease.
My understanding is that she wasn't ill at all in the previous week, and that's what's so scary about this particular disease, is it almost always hits perfectly healthy people suddenly without any warning.
Schlenker says more testing will be done to see if Thorpe and Suri died of the same bacteria subtype, but no connection between the two is expected. Officials say most meningococcal cases are random and isolated. However, it is possible to transmit the disease by close contact. Thorpe's close friends and family and others are now being identified by public health nurses and will be asked to go on antibiotics. Now, meningococcal disease is the leading cause of bacterial meningitis in kids ages 2 through 18. The inflammation of the brain and spinal cord strikes up to 2,600 in the U.S. each year, and even with antibiotics, up to 15% die. That's why experts advise kids starting at age 11, as well as those going to college or in the military, get vaccinated. Signs of meningococcal disease vary widely, but can include sudden onset of a high fever, headache, vomiting, a stiff neck, and a rash, potentially. You might also be sensitive to light, sleepy, and confused. The CDC says the symptoms can develop over several hours, over 1 to 2 days, but they can happen, obviously, very quickly. So, and if you feel that, get to the doctor or the ER and stay away from people and don't share cups, utensils, anything like that, obviously.
Very good information. Linda Eggert reporting. Linda, thanks.